Good evening, everyone. I'm Riley King, and welcome to my evening news report right here on the Riley King Network. Let's begin. Four more deaths linked to COVID 19 outbreaks at long term care facilities in New Hampshire. Sununu announces stipend program from frontline workers at long-term care facilities. As four more deaths linked to COVID-19 outbreaks at long-term care facilities were announced Tuesday, Governor Chris Sununu said frontline workers helping the state's most vulnerable will receive new weekly stipends. Healthcare Commissioner Lori Shipperton said three of the people who died were residents of Hanover Hill Healthcare Center, and one was a resident of the Huntington at Nashua. She said the people did not die recently, but the deaths were just confirmed to be related to COVID-19. Dr. Benjamin Chan, the state epidemiologist, said there have been 73 more cases of COVID-19 confirmed in New Hampshire, bringing the total to 1,091. He said about 30 of those cases came in a batch from tests done at the Massachusetts Public Health Laboratory. Sununu said starting as soon as Wednesday, frontline workers at Medicaid-funded long-term care facilities or in-home health care environments will be able to apply for 300 weekly stipends. The governor said those workers protect New Hampshire's most vulnerable individuals, and the state must strengthen its commitment to them. The Department of Employment Security will use general funds to pay for the stipends, with the expectation that the money will be backfilled by federal funds later, Sununu said. Sununu said the state is also partnering with Convent MD to expand testing for workers at long-term care facilities. Mobile testing sites will be set up near the facilities in Hillsborough and Rockingham counties, with the goal of testing all 6,600 workers in those facilities. Sununu said about 70% of all positive cases in the state are in those two counties. The cost of the testing will be borne by the state, Sununu said. Chan said the number of people hospitalized for COVID-19 has stabilized about 70 people on any given day. There have been 163 people who have required hospitalizations in New Hampshire throughout the course of the pandemic. Chan said the hospitalization numbers will likely fluctuate, but it's a good sign that healthcare facilities have not experienced a surge that has stressed their resources. Even though hospitalizations appear to have plateaued, Chan said continued adherence to social distancing and other precautionary measures must continue to prevent a wider outbreak. Chan said the pandemic is likely to last weeks, if not months, longer, so it's crucial that people stay home, except for essential trips, and continue practice good hygiene. He said anyone who needs to go out should wear a face covering to prevent the transmission of respiratory sections. And that does it for my evening news report right here on the Riley King Network. I hope you all have a good evening, and I'll see you back here tomorrow for another news report. Good night and bye, everyone.